New deaths from COVID-19 have reached their lowest point since March of 2020. The World Health Organization says the end of the pandemic phase of the virus is in sight. But in a 60 Minutes interview with Scott Pelley, President Biden had a more optimistic take on the situation.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape. And so I think it's changing, and I think this is a perfect example of it.
So let's bring in Dr. Celine Goguen. She's the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist, an epidemiologist, and a CBS News medical contributor. And I am really curious to get your take on what the president had to say. I know the numbers continue to go down. I also saw a recent article saying, hey, thousands and thousands of people continue to die of COVID. Is the pandemic over?
Anne-Marie, my question for the president is, by that, does he mean that 3,000 deaths per week from COVID is okay? That 150,000 deaths in this country per year is okay? Does he mean that deaths among certain populations, the elderly, the immunocompromised, people of color, that is something we're okay to accept? That there's no public and public health, that it's a you do you, every man for himself health? Then perhaps I suppose, but I would ask the president, can't America do better?
So is the end of the pandemic in sight? Or how would you characterize where we are in this?
We certainly have the tools, as many have said. We have vaccines, we have testing, we have treatment. But are we using those tools as best as we can? And what we've seen, in particular with testing and treatment, that we've really underutilized those tools to keep people safe, to get them early treatment. And there are other things like that other countries do have, things like health care for everybody, health insurance for everybody, paid sick and family medical leave, that really do help reduce the risk that we simply don't have in this country for many people.
Yeah, I mean, I think about just the availability of testing now, which has gone way down. I actually can't think right now off the top of my head where I would find a test. I'm sure I could if I wanted to, but it certainly isn't what it had been before. Let me ask you, though, about where we are in terms of vaccines. Booster shots are available now for most Americans ages 12 and up. What's your recommendation? And in regards to booster shots, I don't even know because I haven't actually gotten a booster since I got my sort of third shot, I readily admit. How do you go about getting a booster shot? Are they openly available now?
So there's a website that the government still has available, vaccines.gov, where you can look up where you can get different vaccines in your area, depending on your age group. A couple rules to follow. One, you should wait at least 3 months after your most recent COVID infection or your most recent vaccination before getting a booster. If you get it too early, it's not going to take. So it's really counterproductive. Number two, if you're age 50 or over, you're immunocompromised, those people should be going out and getting a booster as soon as they're eligible. In other words, after that 3-month window. If you're under 50 and you're pretty healthy, what I would suggest is waiting a little bit. It's less for your own protection. It's actually more for the protection of other people that you would be getting vaccinated, say your older grandmother who you might see at Thanksgiving or Christmas. Wait until like 2 to 4 weeks before you're going to see those more vulnerable people and then get your booster.
Very smart. Do side effects from these boosters, are they different than the side effects that some people had previously? I mean, I had one of my shots, I was sort of under the weather for a day, but the other ones were actually fine.
Yeah, we're not really seeing any different side effects. The vaccine formulations are essentially identical, except for this tiny little tweak in the mRNA. So your side effects should be the same. Maybe take a little bit of Advil or ibuprofen if you're having fevers or muscle aches afterwards. But I really wouldn't anticipate anything different from what you've had before.
Let's talk about monkeypox really quickly. So China's reporting its first known case of the virus. It's actually advising senior health officials. They're advising people to avoid contact with foreigners. What's your take on that statement?
Well, it recalls what we did early in COVID, right? The way we stigmatized Asians in the U.S. I think it's very much the same kind of psychology, but to remember how monkeypox is transmitted, it is transmitted through very close, generally intimate contact. Could be sexual contact, could be, say, caregiving for a young child, but it really requires that very intimate kind of contact to be transmitted.
And of course, it didn't stop COVID from spreading here. We have a virus that, as you point out, is not as contagious because it takes sort of an additional step to to make it contagious. But that's what we're hearing from China right now. Dr. Celine Goguen, thank you very much. We are